Scalese. He's the Walgreens Area Healthcare Supervisor for New Jersey. We are pleased to be joined today here by Governor Christie, Dr. Joseph Barone, Dean of Rutgers University School of Pharmacy, Dr. Asa Yee, Chief Pharmacist for the New Jersey Department of Health, Howard Pine, Deputy Director of the New Jersey Division of Consumers Affairs, Tom Bedner, President of the New Jersey Board of Pharmacy, John Hogue, President of the New Jersey Retail Merchants Association, Kim Treese, our Regional Vice President with Walgreens, and the Mayor of East Brunswick, Kevin McAvoy. You will hear from Governor Christie shortly, but at this time I'd like to introduce John to say a few remarks on behalf of Walgreens.
Thank you, Dominic. I'd like to start by saying this is actually a bit of a homecoming for me, having grown up here in East Brunswick, graduating from East Brunswick High School. Mr. McAvoy was my history teacher, actually, ironically. And I actually started my career in this exact pharmacy some 20 years ago while I attended the Rutgers University School of Pharmacy, so it's really great to be back. As you may recall, earlier this year, Walgreens announced two very important initiatives. First, an effort to combat prescription drug abuse and curb the misuse of medications by installing safe medication disposal kiosks in 500 of our locations nationwide. And second, to decrease the risk in overdose deaths, we are making naloxone, a potentially life-saving opioid antidote, more accessible and easier to obtain. And here's an example of what naloxone looks like. Today I'm pleased to tell you that we are delivering on both of these important programs here in New Jersey. With the launch of our safe medication disposal program, like the one you see right back here, and availability of naloxone without requiring a prescription throughout the state. Making naloxone available without requiring a prescription in all Walgreens pharmacies in New Jersey is a significant step in our commitment to make the medication more accessible and easier to reach in communities throughout the country. These are available for anyone to purchase, including caregivers and loved ones of those afflicted with addiction. And now a little bit more about what we're here for today. We are committed to making it easier for people to safely dispose of unused, over-the-counter, and prescription medications, including controlled dangerous substances. Safe medication disposal kiosks have been installed in select Walgreens drugstores, such as this, throughout the state of New Jersey, and we are continuing our installation efforts nationally. Specifically, these have been installed in 16 24-hour Walgreens locations strategically located throughout the state of New Jersey in the population centers. This is the first national initiative of its kind by any pharmacy and is available to all patients at no cost. So why is it important to offer safe disposal kiosks in our pharmacies? Well, the fact remains prescription drug abuse continues to be a public health and safety risk in our country. Studies show that in 2014 alone, an estimated 6.5 million Americans abused a prescription drug. And the Centers for Disease Control reported that more than 47,000 people died of a drug overdose that same year. And New Jersey has certainly not been immune to that. As a pharmacy, we have determined that we could and should play a stronger role in reducing the misuse of medications and help reduce the rise in overdose deaths through the programs we are implementing here today. Each day, inside convenient Walgreens pharmacies in communities across the country, our trusted pharmacists play an important role in counseling patients on the safe use of their medications. But we also know that not all of these medications are finished by the patient for really a variety of reasons. The patient's doctor may have changed the medication, the patient may have gotten better, or for whatever reason decided to no longer take their medicines. The question those patients have is always, well, now what do I do with these medications? I will tell you that I remember answering that exact question in this pharmacy 20 years ago, and we continue getting those questions today. Many people don't realize that it's not a good idea to flush them down the toilet, which can lead to all kinds of environmental problems. And it's also not recommended to simply toss them in the trash. We need to make the safe disposal of medications easier, and these kiosks do just that. Using a safe medication disposal kiosk at participating Walgreens locations is one of the best ways to ensure medications are not accidentally used, or more importantly, intentionally misused by somebody else. And finally, by installing safe medication disposal kiosks nationally, by continuing to counsel patients on the safe disposal of medications, and by taking steps to make a life-saving opioid antidote more accessible, I'm proud to say today that Walgreens is now leading the way in the fight against prescription drug abuse. So thank you again for attending, and now allow me to introduce you to our Governor, Chris Christie. Chris Christie was sworn in as Governor of New Jersey on January 19th, 2010. He was re-elected to his second term on November 5th, 2013. And under Governor Christie's administration, New Jersey has taken on the biggest and toughest challenges with real solutions and bipartisan cooperation. He has implemented an aggressive reform agenda to restore fiscal integrity and accountability to state and local government, lowered New Jersey's property taxes, and reformed treatment for individuals convicted of nonviolent drug offenses. And he has improved public education to ensure every child has access to a quality education. As a fellow lifelong New Jerseyan, Governor Christie has a deep affection for and a strong commitment to the state in which he has spent his entire life. Please join me now in welcoming our Governor, Chris Christie.
Well, good morning, everybody. Thank you all for coming today. I first want to thank John for the introduction and thank Walgreens. You know, their unveiling of this safe medication disposal kiosk both here and 16 other locations across New Jersey. It's difficult to tell you how important this is. You know, a lot of times folks get medications for absolutely appropriate purposes. And as John said, don't use all of them. And especially when we're considering opioids, those sit around the house. And that is a ticking time bomb inside each and every person's house. Can't tell you how many people I've heard have fallen to heroin addiction starting with prescription opioids that they took either at a doctor's instruction or that they obtained in other more nefarious ways. And one of those ways is both through the use inside a family of opioids that are left unused, or breaking and entering homes to steal those items for folks who have reason to believe they're in there. The ability for people to be able to safely, not hurting our environment, dispose of those drugs are an important public safety measure. And that's why I'm glad Prosecutor Carey from Middlesex County is here today. He and I have a long history together. He worked with me at the United States Attorney's Office. And he's doing an outstanding job as the prosecutor here. And he is committed to not only the strict enforcement of the laws here, as are the police officers who are here from East Brunswick, but also to making sure that people get the type of treatment that they need to be able to deal with the disease of drug addiction. All the different pathways to addiction need to be addressed. We had a candlelight vigil last night on the front steps of the State House. We gave out 750 candles to people who were supporters of this cause. And we're going to continue to talk about this and work on it to remove the stigma from drug addiction. One of the ways to do that is to have corporate leaders like Walgreens acknowledge the problem and come up with innovative solutions to deal with some of the causes. I know too that Rutgers has been a leader in this as well. Our pharmacy school here at Rutgers is recognized nationally as one of the best in the nation. And I appreciate the dean being here. And the education that those who are trained at Rutgers get also teaches them not only about how to safely dispense drugs, but also to deal and interact with the patients who come into stores like this and want advice and counsel on how to deal with the utilization of these medications and the potential dangers that they could present to others who are ingesting them without the direction of a doctor. Our pharmacists are a key link in that chain to do it safely, and they're all too often not recognized for that. And I want to thank those folks at Rutgers who begin their education process, and then folks like Walgreens who are continuing to emphasize as they employ folks from Rutgers and other schools around the nation that their job doesn't just stop with the dispensing of the medication, but in the interaction with the patient and helping them to understand not only the benefits of the medication they're receiving, but the potential dangers of it, how they have to deal with them. I'm also incredibly grateful to Walgreens for stepping out and doing this in New Jersey in an aggressive way. I'm glad to hear they're doing it around the nation, but I'm glad they're right here in New Jersey doing this. You know, we have had Project Medicine Drop since 2011. It's resulted in the collection of 139,000 pounds, just less than 70 tons of unused medications. As of this past September, 212 stationary drop boxes and 148 mobile ones have been issued statewide. We also have expanded the prescription monitoring program, an innovative data sharing partnership between the Attorney General's office, our state's physician prescribers, and our pharmacists. They continue to be a vital resource that keeps detailed information on every prescription filled in New Jersey for medications that are controlled dangerous substances, including potentially addictive opiate painkillers. We now have agreements with all of our neighboring states to share that information so that people try to doctor shop across the Hudson River, across the Delaware River, or the Delaware Bay, that we can keep an eye on that as well. Physicians need to be watched for those who are creating painkiller mills just to make money, but also patients need to be monitored to make sure that they're not using false symptoms and bad stories to coerce doctors into giving them prescriptions for this. And the Attorney General is going to have more to say about this in the new year as well. We're going to get more aggressive on this front. Since September of 11, the database has captured information on more than 59 million written prescriptions for CDS in our state. 59 million. And I will tell you, I'm going to continue to talk to physicians across the state about the frequency with which they're writing these prescriptions and the amounts that they're writing them for. I've told this story a number of times publicly. 2 summers ago, my then 18-year-old daughter had 2 wisdom teeth removed. And she came home, stopped at the pharmacy to pick up her prescription, and came home with 30 Percocet. 30 Percocet for 2 wisdom teeth. When I saw that, I took them and told her that she could take some Advil and put some ice on it. And I, you know, I called the physician and I asked him, what do you think of giving an 18-year-old college student 30 Percocet for 2 wisdom teeth? And the answer was a standard operating procedure. Well, we're not in standard times anymore regarding the opiate crisis. We are seeing more and more people die from this addiction. And while they have a useful medical purpose, we need to also understand the danger of these medications, especially for people who come from a family background of addictive behavior. And I don't think that physicians, quite frankly, are acknowledging that enough and the role that that plays. So we need to work as a society together to do this. And programs like what Walgreens is doing here re-emphasizes to people that those pills in the bottle, even though they have a useful purpose of given you by a physician, can also be dangerous. And having a special place to dispose of them re-emphasizes to people the potential danger of those drugs. I mean, not only are we doing it with our regional states, but the prescription monitoring program, we're now sharing with South Carolina, with Minnesota, with Rhode Island, with Virginia, in addition to Connecticut, Delaware, and New York. So no matter where you go in this area and beyond, if you're doctor shopping to get opiates or other dangerous drugs, we're going to be able to find out. And do 2 things. 1, intervene to stop the harm, and 2, if you're in danger, to get you help from addiction. The holiday season is a time of enormous triggers for people emotionally, both positive and negative. The positive ones we usually don't have to worry about. But the negative ones, especially for people who are in recovery or struggling to get to recovery, can sometimes be overwhelming. That's why I'm so glad that they're participating in this program as well. And to make sure that this antidote is available for those who are in the midst of heroin overdose, we have worked with the prosecutors and the police to make sure that it's broadly available across the state for our first responders. And now that Walgreens is participating in making this available for families as well. Last night at the candlelight vigil, one family, mother and father, got up and talked about walking into their son's bedroom and finding him on the floor unconscious from a heroin overdose. If they had this drug, maybe they could have saved his life and given him another chance to overcome his addiction. It's something we need to do and need to acknowledge around the state. because it happens to every family. There's not a family in this state that's not touched by this in one way or another. If not directly in your nuclear family, your extended family, your neighbors, your friends, your coworkers. All of us, if we take a little time to think about it, know that we have people in our lives who are touched by addiction. And I want you to think about those folks during this holiday season and think to yourself, do you think that they're lesser parents because of this happening? Do you think that they're lesser spouses, lesser siblings because this has happened inside their family? I think when you think about it, the answer is no. Yet our society treats those folks as if somehow they've failed, that it was a mistake, neglect, bad values that lead to these problems. This is a disease. And it's a disease that needs to be treated just like cancer or diabetes or heart disease. By the way, all of those diseases, in part, have an element to them where the patient does certain things that can help to cause the disease. Yet we don't stigmatize those people. We don't say if you have to go in for bypass surgery, well, too many steaks, you deserve it. Right? You know, we don't stigmatize the cancer patient because they were a smoker. We don't stigmatize the diabetes patient because we say, well, too many carbs, too much sugar. We don't do that. We say to those people, come to us, we'll treat you and help you get better. But I want you all to think about whether we say that to the heroin addict, the one addicted to over-the-counter opiates. We don't. We make a value judgment. We make a moral judgment on those people. Now, I'm not saying that the choice to try those drugs in the first place was a right one. It wasn't. But I suspect there's no one in this store this morning who hasn't made a mistake that they wish they could take back. An action, a judgment in your life that you wish you could do over. I know I have, plenty. And the lucky part for me was that it never involved drugs. But there, but for the grace of God, go I. And so programs like this, once again, raise awareness, raise everyone's sense that this is a fight we need to all have together. This is not something that the police can take care of on their own. This is not something that we're going to fix by throwing every person in jail. We need to treat these folks and teach them that there's another option for them. I want to thank the mayor as well. I'm sure he was an outstanding history teacher as well. We can talk about that one another time. But you know, the mayor and other mayors like him are the men and women on the front lines of this fight. You know, whenever there's a problem in town, it's the mayor who hears about it, right? He comes into Walgreens to pick up his prescription, someone grabs him and talks about a road that needs to be paved, or a soccer field that doesn't look like it's supposed to, or, you know, the recycling didn't get picked up when it was supposed to be, right? Every little problem. But he gets the big problems too. He gets the big problems too, and so do the members of the council. And when you have a death in your town of a teenager, it affects your school, it affects your community, it affects your police force. All those people come into interaction with that family who has that kind of loss. And so the mayor and the council people in East Brunswick are providing leadership that's really important, because they're going to hear about that before I am. And they're going to know that person, and I probably won't. And those things have a real effect on people's ability to cope and how they feel about where they live. So this is a really important issue, and one that we've worked on the entire time I've been governor. We're going to continue to until the day I leave. But we need your help too. So I want to end by just thanking Walgreens for not only for hosting us today, but much more important than that, they have taken a corporate position that is pro-treatment. They've taken a corporate position that is in favor of protecting all in our society who need protection, and not making a moral judgment on that, but deciding they want to deal with the issue forthrightly and directly. Those are the type of corporate citizens we need more of in our state and in our country. If we do that, we're going to help to deal with this problem and save a lot of lives. So I think this is going to be my last public appearance before Christmas. I don't think they're going to be doing something tomorrow. So I want to wish all of you Merry Christmas. This is my last public appearance. Now I get to go Christmas shopping.
You got a perfect store for it.
What are all these cameras? How much I don't want anybody to know exactly, because Mrs. Christie and the others do watch what I do, so we don't want to tee them off, early and give them the tip as to what we're going to be getting for Christmas. But I want to wish all of you Merry Christmas. Wish you the best for your family and your loved ones over this holiday time. Everyone stay safe. Please don't get behind the wheel if you're a little bit impaired. No problem getting a little impaired during this holiday season. A couple glasses of wine never hurts anybody unless you get behind the wheel of a car. And then if you do, you put your own life at risk and others as well. Let's try to keep that to a minimum as well. And know that from me and from Mary Pat and from our family, as we finish our 7th year as governor, we all feel incredibly privileged to have the opportunity to be the governor of the place where I was born and raised. And every day of this job, the good ones and the not so good ones, are an enormous privilege. And this fight in saving lives is one of those great opportunities you get as governor. Whenever 4th graders, and lots of 4th graders come to the State House to visit, because 4th grade, as our history teacher will tell you, is in New Jersey, the year that you learn about New Jersey in social studies. And so 4th graders come to the State House all the time. They all ask me at least the same 2 questions. They sometimes have more, but the same 2 questions all the time. Favorite color? For some reason they're fascinated what your favorite color is. Second question they always ask is, what's the best part of being governor? And I give them the same answer and have for the last 7 years. That every morning when I get up, I have a chance to do something great. I don't do something great every day because I'm human. But every morning I have a chance to do something great. This is the great thing we get to do today. So let people across the state know that if they come to a Walgreens, they can deposit safely their unused medication so it doesn't hurt our environment. More importantly, it doesn't hurt a member of their family or a loved one. That's a good day today. And I want to thank Walgreens for helping me have a good day. And I look forward to the new year, as I'm sure you all do, with great hope and with an expectation that we'll have even better times in 2017 than we had in 2016. So thank you to Walgreens, thank you to the mayor and the members of the council, our friends at Rutgers, and all the folks who do such great work every day for the people of the state, most especially my friend, the Middlesex County prosecutor, who has a tough job, but he does it well, very well every day, and I'm proud that he's taken on that responsibility, and I wish he and his family a special Merry Christmas as well. Thank you all very much.
Thank you.